David with No Chaser. You like the setup I got here? The nice looking out the window like I'm all deep in the snow. Anyways, No Chaser. Today's topic is the fun topic of co-occurring disorders. So, because you can't just have, mental health problems. You got to throw a little substance abuse problems with that too. So, if you're not aware, co-occurring disorders is basically having some form of mental or emotional mental health issue with a substance abuse issue. So that would be, if you have PTSD and alcoholism, it's kind of like one of those mix and match things, like they have at Applebee's where you could do you want OCD with addiction to meth, or what about schizoaffective disorder with marijuana smoking? Or let's really spice this up. Let's get major depression with fentanyl abuse. Okay, so don't mean to be so flippant about this. You have to laugh at some of this stuff. But one thing I was thinking about this topic, this could go in a whole bunch of different directions, but the reason I wanted to talk about this was because, as of right now, I am embarking on a different avenue of depression treatment. And, and people were talking to me about it, and they're asking me about it, how's it going and everything like that. And, whenever it comes up, people ask what I tried before, and I talked with another person that was looking to do some other forms of depression treatment beyond therapy. And, I always preface this, I don't know why I feel the need to do it, but I always say that I tried this, I tried this medication, or I tried doing this thing when I was sober. Because I will never, say that something didn't work for me if I happened to be drinking during it. It's just not fair, because the truth is that I think you can talk about being depressed or dealing with anxiety and trying to stay sober in a recovery program. And if you're dealing with that depression or anxiety, you may, and you're trying a different SMART recovery or AA or a refuge or Dharma recovery, you can have a pretty good, if you're failing in your mental health issues, you could still have a pretty good grasp of if that program could work for you or not. However, if you flip it around and you are trying, a new counselor, or you're trying a new medication for your mental health issues, or you're trying, some different form of treatment, but you are still failing in the substance abuse category, none of that matters. Because the thing is that you can never get a good estimate on how effective something is if you are still drinking or using. It's just a lot of people talk about, when it comes to co-occurring disorders, if it's a chicken or the egg thing, what came first? Do you think that it was the self-medication, or do you think that all the issues that come with being, addicted to something and having basically your brain hijacked by, alcoholism, if that brings on all these other things? And, it's like many things that come with psychology, it's a big whole bunch of gray, it's a whole bunch of it's not always one or the other. There's no really hard and fast rules about if you are suffering from this thing, you have to do this, this, and this, or this will never work. Or if you're suffering from, this form of depression, or if you're suffering from this form of mania, or if you're suffering from this form of, borderline personality disorder or bipolar disorder. But the one thing that I would say is I would put my reputation, I don't know, I would put my for any sort of major advice, psychiatric advice, obviously see a doctor, see an actual person that finished their mental health counseling career, seek professional help. But if there was one thing where I would say that no matter how I'm doing or how I'm doing in my own recovery program, what I could at least stand by and say, I believe this and I know this to be true, is that if you are trying to remedy any sort of mental health problem, if you're suffering, like I said, you're suffering from anxiety, and there is other issues like schizophrenia, OCD. I'm talking about more of the emotional, borderline personality disorders. I'm talking about things like depression, anxiety, or even PTSD or impulsivity. If you are suffering from that and you're trying to try something out to see if you can remedy it and get help for it, and you are still drinking or using, it does not matter. Again, there could be some exception that proves the rule, or I guess exception that proves the rule. Rather, there could be someone out there that has, that was like still struggling with their drinking but tried something and it pulled them out of it. But for the most part, it just doesn't work that way, because the way that I've always seen it is that when you're engaged in active alcoholism or active addiction, your mind is in a different place, especially not just in terms of being under the influence, but the way your mindset is. Like the way that you even see the world, the way that you're approaching the day, the way that you're handling your problems, or rather not handling your problems. So if you're working with a counselor, if you're trying to do some things like, trauma therapy, or you're trying to do like CBT, like cognitive behavioral therapy, or you're working with a DBT counselor, all the BBTs, the EBT, like whatever. If you're trying to do these things, but you're still relapsing, or rather you're still, you haven't been able to remain fully sober, or let's say that your problem was drinking, and you're doing like harm reduction where you're not drinking, but you're still smoking weed and you're still dependent on weed. Whatever you're going to try to do to see if it can fix your depression, anxiety, PTSD, it's not going to work. Like, it's not going to work in the sense that, when I go back to what I originally started this was that I always preface it by saying, by the way, I tried these things when I was sober. And even when I say I tried some things, I go, don't take my word for it. Everybody's different. But, I've tried ECTs, which is the, electroconvulsive therapy for depression. I tried all the antidepressants you can think of. I've tried all these different type of things, but I always preface it when people know that, I suffer also from alcoholism and addiction. I always say, and when I did try these things, I was sober when I did it. Because I know a lot of people that, they talked about their experiences with like medications is a big one. But when, throughout like talking with them, whether it was in group therapy or whether it was in some outpatient program I was in, maybe a couple of weeks down the line, I realized that, oh wait, you were still drinking when you were taking Zoloft, or you were still relapsing back and forth. Like, I wouldn't say anything to them, but in my mind, I'd be like, well, that's not like a fair assessment, because drinking, relapsing, using drugs, like being in your active addiction, that's just going to throw off whatever you're trying to do, whether it's medication, whether it's even therapy. You could have a great therapist. You could have the Robin Williams from Good Will Hunting level, like, therapy guy. Was he a good therapist? I don't know. He did choke Matt Damon in that movie. I think that's against, ethics at least. But, you could have the best therapist in the world, but it won't matter if you're still in your own cycle of active addiction and active drinking. And what kind of spurned on this topic was that I was just thinking of that, is that someone had said, like, you always mention, like, I was sober, and some people, would say, like, well, I assumed you were sober. And I was like, well, maybe not. So, like, this is just, I rarely like to give any sort of, any advice of, like, this is what I think you should do, because it's your own journey, and, like, I struggle myself, but if there's one thing I would say is that if you are getting advice from other people of things they did specifically for mental health, always make sure that if they said it didn't work, or they said they found really bad results with it, just make sure that you knew the person was sober the entire time they were doing it, and in some program of recovery too. If they said that, I tried seeing, I tried going even with other people, like I tried going to the marriage counselor, the family counselor thing wasn't working. It's like, well, were you still drinking during that time? Because, like I said, it's a non-starter. If you weren't sober during that time of group therapy, of individual therapy, of EDMR, if you were, any types of all the myriad of things you could do out there to, like, improve your mental health, if you're still drinking or using during that time, it's not going to work. Now that I think about it, I don't know if I need a whole video for that, but I guess I like to ramble a lot. But anyways, hope all y'all are out there well. I'll give an update, here soon. I'm going to go for my second infusion, which sounds all sciencey, but I'm doing the ketamine-assisted treatment. And that's kind of also what brought on this topic, is that, I've remained sober and everything like that, and it's been going well so far. So, but you know, people have asked me how it's been going, and that's what brought this topic on. It's just like, if you're gonna give any credence to anything, and you have a co-occurring disorder, you have to make sure you were sober and really like giving it the full 100% to see if it really will work or not. Like, subscribe, do all the things, or don't. You know what? I'm not gonna tell you what to do. You live your life. Anyways, with that being said, I never know how to end any of this stuff. Be well.